Progress in small cell has been a little bit slower and lagging behind non-small cell lung cancer, primarily because it is a rarer subtype of lung cancer. And I really think it's mostly that. It is also a very difficult disease to tackle. There hasn't been adequate funding, as far as I'm concerned, paying attention to the disease. And again, some of that is because the non-small cell lung cancer subtype is such a major issue and such a large patient population that suffers from it, that I think a lot of people put their resources into finding better ways of treating the non-small cell moiety. I have seen definite changes in that area. First of all, let's also be a little bit honest. Over the last decade or two, there have been a number of studies with different drugs for small cell. Unfortunately, none of those were successful. So I think small cell never got the attention because no matter what we tried, the same platinum doublet drug that we've been using for 20 some odd years ended up being better than anything else we've tried. So I think for that reason, it hasn't gotten the kind of attention that non-small cell got with the approval of different drugs and the molecular subtypes and immunotherapy and all of that. But there is a movement in the field. There is a definite interest in finding more about small cell. There are labs and centers and investigators who are actually devoting their entire careers to small cell, trying to find molecular subtypes that might be able to be treated specifically. Immunotherapy, particularly combination of a couple of different drugs, have been reported at several different meetings, specifically for patients with small cell lung cancer, and all of them are actually very promising. In the last year's ASCO, there was a session where we actually had a couple of potentially new drugs introduced to us for small cell. And again, based on these smaller phase 1, phase 2 studies, there seems to be a movement in the field for small cell. And I think there is actually a lot of hope that in not too distant future, we're going to have new and better options for patients with small cell. But it is a little bit slower, again, because it is a more rare type of lung cancer, and also because when you want to do a large study with small cell patients, you have to have many centers involved. And also, you sort of have to move very quickly with this patient population. They tend to deteriorate kind of quickly if you don't get them started on treatment. And I think that has been part of the challenge working with patients who have small cell, the rapid growth of the tumor and the deterioration in patients' performance status has always been an important issue here. But again, overall, I'm very hopeful that we are going to have new treatment options for the patients.